lives in Eugene, Roseburg, and Coos Bay. Kval News at 6 starts now.
First at 6, vaccine efforts underway for more than 3 months now, and at this point, more than 1,100,000 Oregonians have received at least their first dose. Thank you so much for joining us. I'm Jacqueline Fernandez.
I'm David Walker. We have coronavirus team coverage for you tonight.
Kval's Lauren Negretti is standing by to break down an increase in COVID-19 cases in children.
But first, Hadley Heck is here in the studio with us, has some insights about vaccinations here in Oregon. Hadley?
That's right, David. According to researchers at Oregon State University, it's been a challenge to vaccinate communities of color. The Latinx community represents 34% of the infections of coronavirus in Oregon, and only 7% of the Latinx population has been vaccinated.
The more that Oregon receives vaccines from Johnson & Johnson, which only require one visit and one dose rather than a double dose visit like Moderna and the Pfizer BioNTech, that may help some of the access issues.
Researchers point to background issues of inequitable access within our healthcare system, along with language and education barriers. These issues have resulted in vaccine hesitancy in communities of color, but as more people get the shot, there's hope this may change.
They are now coming out finally to get their vaccines. And I think as that community experience grows, the resistance to accepting the vaccine will get lower.
Right now, Oregon allocation of the Johnson & Johnson vaccine is relatively small, but moving towards one-dose vaccines may help access issues. Experts are also currently working to understand the longevity of fully vaccinated immunity for our populations moving forward. Back to you.
All right, Hadley, thank you. Pregnant women in Oregon can get the vaccine now. A recent study shows pregnant women who get the vaccine protect themselves and their babies. While some are worried about the effect of the vaccine on those who are pregnant, doctors say the science shows they're safe.
We have no reason to believe that the COVID vaccines, knowing how they were made, are going to be any more dangerous for pregnant women than any other vaccines.
Researchers found those vaccines gave the pregnant or breastfeeding women robust hormonal immunity. They also found the antibodies created from the vaccine were much higher than antibodies gained from a natural infection.
Taking a look at the latest vaccine numbers in Oregon, more than 1.1 million people received at least one dose of the vaccine, and more than 667,000 are fully vaccinated. Next Monday, eligibility will open up to frontline workers and adults over 16 with underlying conditions.
Let's take a look at the latest numbers in the pandemic. Today, the Oregon Health Authority is reporting 415 new or presumptive cases and 6 more deaths. In total, more than 164,000 Oregonians have tested positive for the virus. More than 2,300 have died.
Here in Lane County, we're seeing dramatic rise of COVID-19 in school-aged children. Kval's Lauren Negretti joins us now. Lauren, it's important to note these cases are not related to schools reopening.
To gatherings and other activities outside of school. The case numbers are still low, but the increase has local public health and a Peace Health doctor stressing the need to continue health and safety measures.
We are seeing a pretty dramatic increase in school-age children cases.
Normally, there's 10 cases over a week. It doubled last week. Davis says the rise is tied to out-of-school activities and social gatherings.
Teaching at schools could potentially result in cases just with greater exposure. That's bound to happen.
Davis says while schools are doing a good job at reducing transmission risk, parents need to make sure outside activities are safe. He says social gatherings are causing county case rates to rise. COVID-19 in kids can be difficult.
Many children are asymptomatic.
Peace Health pediatrician Dr. Lauren Herbert says if kids do show symptoms, they're mild and are similar to other illnesses.
There's some children that just have, cough and fever, and other children that have more gastrointestinal symptoms.
Multi-system inflammatory symptom can happen weeks after an infection, but it's rare. Vaccinations and infection preventions would stop that from happening. Herbert says while people may be tired of the prevention measures, they must continue.
Just continuing the masking and hand hygiene and distancing.
Davis stresses the importance of measures and vaccinations. In Lane County, 16% of the total population is fully vaccinated. Oregon Health Authority reports 25% of Oregonians have received their first dose. Nationally, it's 26%. Back to you.
All right, Lauren, thanks. Health officials here in the Northwest say variants popping up in Oregon and Washington could be a cause for concern, even causing another surge. Well, this comes as counties here are reopening, leaving many wondering if we should be opening in the first place. Kval's Kelly Azer has the details tonight.
Are community closures a thing of the past? Unfortunately, no one knows that answer. But doctors say we are doing the right thing by opening slowly.
So the guidance that we are issuing is really in response to these variants, recognizing that yes, there are more variants, and yes, we're worried that some may be more infectious and potentially not respond, our current vaccines may not respond quite as well to them. But we are opening with this in mind, trying to keep Oregonians safe.
Though well off January spikes, both Washington and Oregon report daily case counts are edging up again. And a variable we all hoped wouldn't come has arrived, with variants reported in both states. While those variant numbers are still low, we do know the UK variant is proving more dangerous and deadly, especially among healthy young adults. But health officials in the area credit the increasing number of vaccinated people, along with our hard work of social distancing and masking, saying it's paying off.
We're getting really good data back from our vaccines, that they are effective even against the new variants, and that the new variants are not spreading widely in Oregon.
Kelly Azer, Kval News.
Oregon lawmakers are working on a plan to repay people who saw their Oregon taxes go up after receiving a stimulus payment. The stimulus increased the state tax liability for close to 900,000 Oregonians. It's an unfortunate consequence of the state tax code. Just 5 other states have a similar rule. Lawmakers met with Department of Revenue staff to talk through logistics this week. It will likely take months for the state to return that money.
But the very best way to do that is by building it into the next tax season, because then we can put it into the forms, into the instructions. We can work with all of those e-file vendors to make sure it's built in right from the front, and then the correction will automatically calculate.
If the state tried to repay people this year, Oregonians may not see that money until fall or winter. We'll bring you updates as this story progresses.
More COVID stimulus checks are going out this week. This batch is expected to go to Social Security recipients and other federal beneficiaries who normally don't file a tax return. According to the IRS, the payments will be issued starting this weekend, and they say people should have the money by April 7th.
New tonight, a grand jury has concluded an officer-involved fatal shooting in Reedsport earlier this month was justified. Today, the Douglas County District Attorney details what happened that night. Kval's David Ochoa reports.
And make no mistake, Rousey was a cold-blooded killer.
David Rousey Jr. was shot 5 times by police after a 5-hour standoff. Rousey was believed to have killed Richard Marshall in Springfield just days before.
Based on what appeared to be a suicide by cop threat made by a known murder suspect, Springfield police detectives sought the assistance of the FBI to ping or locate Rousey's phone.
The FBI's help led detectives to Reedsport. Rousey and another man were pulled over and the driver was immediately detained. But Rousey refused. He said he was never going back to prison. He was going to Valhalla.
Rousey said he would not do time in a box above ground. He would rather do time in a box underground.
During negotiations, Rousey confessed to murdering Marshall. He claimed he had a split personality named Damien, and that Damien was the one who murdered the 70-year-old man.
At this point, Rousey announced to the officers that he was going to smoke methamphetamine.
Police decided to deploy smoke in the back of the car to encourage Rousey to surrender.
And now the officers become aware that Rousey is looking back at them. Rousey is looking back over his shoulder, and he is selecting targets. He is selecting individuals. He's selecting men to shoot at.
The canister of gas missed the back window and hit the roof of the car. Rousey grabbed his gun and left the car, ready to shoot. That's when 4 officers fired 6 shots, killing Rousey.
His only purpose was to murder yet again another person. Rousey had to be stopped.
Reporting in Douglas County, I'm David Ochoa.
Wesenberg says all the officers involved acted with great skill, professionalism, and restraint.
Well, coming up here on Kval News, it's an octopus with a lot of meaning behind it. Find out why this one represents much more than what meets the eye.
And you have more time to file your tax returns. A friendly reminder tonight. Plus,
I'm Scott Thuman in Washington with who may see a tax increase to pay for President Biden's ambitious infrastructure plan.